The aims and outcomes of Warm and Well North Yorkshire were to raise the awareness of the impact of living in a cold home on your health. It was to then identify people that were living in cold homes and reach them and refer them to the right support across the partnership. And then finally, the outcome would be to reduce excess winter deaths and avoidable hospital admissions.
The Warm and Well project has been one of our responses to a particular issue in North Yorkshire. And North Yorkshire has generally a very healthy population, but that hides the fact that there are some particular issues, particularly in rural areas, particularly affecting the older population who live very often in some of these rural areas. And that's related to fuel poverty.
One of the things that we were very aware of as part of the general awareness raising campaign was people's lack of knowledge about what it meant to be affected by the indirect effects of the cold, particularly in the home. And across rural North Yorkshire, we have some very cold homes. But people didn't realise it was the indirect effects of cold homes that could end up resulting in a suppressed immune system, meaning that they were less able to fight off infections, perhaps more predisposed to asthma or respiratory illness or even pneumonia. That was something that people didn't realise. People understood the direct effects of winter, like slips, trips and falls, but the indirect effects were less likely to be clear.
I'm a green doctor. We're part of the Warm and Well project in North Yorkshire. So a typical visit with the green doctors usually lasts about an hour. 2 of us will arrive. One person will do what's called the tech, which is things like switching light bulbs for LEDs, putting reflective panels behind radiators and draft-proofing doors and windows. And while they're doing that, the other person will be doing the advice side of things.
We all go out to do the home visits specifically for vulnerable people because a lot of the time they can't hear, some people can't hear properly on the phone and they'll get maybe upset and don't end up going for the advice or support that they're entitled to.
Because it seems an awful lot of the people that are talking business over the phone, they speak so fast that you don't have time to catch everything that they're saying. So it's a bit difficult.
I'm from the Yorkshire Energy Doctor based just outside Selby, and we help people with their energy bills and any problems they're having with their energy company or heating their home. We've been working on the Warm and Well project for the last 2 winters. The main activities I've been doing are home energy visits, people in the Selby district, and then also run a lot of staff training sessions for frontline staff who are already out supporting vulnerable residents. In terms of the home visits, we find that's really where you can make a real difference to people. So it's only really going into their home you sort of start to notice lots of additional things that you can help with. One of the main things we try and help with is getting people onto cheaper tariffs. It's a really high percentage of people in the country have never ever changed their energy company, so quite often paying more than they need to.
You could see your breath, keep your house warm. You know, it just changes everything. You know, because heating means hot water, it doesn't only just mean heat. It means hot water and central heating. They sound like basic to most people, but when you haven't got them, you notice.
One of the key things that I've been doing through this project is providing training sessions for frontline staff. I think one of the hardest things when it comes to tackling fuel poverty is actually reaching the people who need the help. But there's so many staff, public sector, voluntary sector, community organisations who come into contact with people who may need the help every day. So it's making sure they're aware of what help's available, right, so they can refer people in.
Yeah. We were very keen at Rural Action Yorkshire to work in a partnership on Warm and Well North Yorkshire because there's so many benefits to doing that. We've selected a wide range of partners with different skills, expertise, specialisms. The partners we chose included home improvement agencies, local authorities, small and large voluntary and community organisations such as Age UK or the Yorkshire Energy Doctor and Citizens Advice Bureau. The reason we did this was to ensure that we were able to reach as many people as possible with as wide a range of services as possible.
We deal with elderly people mainly and put together these social singing sessions. And being a part of the Warm and Well campaign meant that the Warm and Well campaign was able to draw more people in to those events, and therefore enabled us to reach out to more individuals who might want to be a part of what we do. But at the same time, it was useful and interesting to hear them absorbing the messages about staying warm and well during the winter.
So today is a celebration really of the Warm and Well campaign, and we've gathered together lots of people who we think will benefit from listening to the messages, the key messages about staying warm and well.
In the run-up to the event itself, when we were getting involved with inviting people to come along, it was interesting that the conversations we were able to have with some of the individuals, they were quite interested in the fact that they were going to come along to something which would be pleasurable and enjoyable, but also there was a serious message behind it as well, which is people in those sort of age groups are vulnerable to the effect of cold and not being properly prepared for it, maybe not using the appropriate techniques. So all of the things that we talked about in the Warm and Well lunches, I think will be really important for people to take away something to hang on to and some new things to try or to be aware of.
Working in partnership with the Warm and Well project's been really useful for us as an organisation, and I think for the rest of the partners. We've been able to find out about other services that are around North Yorkshire and in our own area and bring those all together, all for a common cause.
That is one of the benefits of the Warm and Well service, that because we are a partnership of 24 organisations, we can share information with the consent of service users about who needs support.
We've been able to help people that we wouldn't have been able to help in previous years through the support that we've been able to give through the home visits and the crisis fund, so it's definitely been an effective partnership.
The other benefit of working in partnership is that we're able to share learning and good practice across the organisations, and we hope to, by doing this, that we'll leave a legacy for Warm and Well North Yorkshire after the funding from British Gas ends.
Working with the Warm and Well partnership has actually been brilliant, because you realise suddenly that there are all these other organisations all sort of working towards the same means, and sometimes you might not even realise what other people are doing, but as soon as you're aware of what services they can offer, it means whoever you come into contact with, you can make sure they're getting all the help they need.
Well, I think it's important that there are people like that go out and try to help people that could do with having a bit of help.
We're really hoping that this agenda becomes mainstream and that it becomes part of everybody's day-to-day actions and day-to-day kind of working life.
We've been able to address the adverse effects of cold homes and the significant relationship between fuel poverty and mental or physical health. With the collaboration of all of the organisations involved, we've been able to have extremely positive impacts on our service users, something we're hoping will continue into the future.
It's really important to me that Warm and Well North Yorkshire has a legacy and continues. The brand Warm and Well North Yorkshire will be used for future projects, and we've also worked with Public Health at North Yorkshire County Council to ensure we can continue to keep the single point of contact running and the helpline. Behind that, there's a range of services that will continue over the coming years, and the partners who worked on Warm and Well North Yorkshire have joined the North Yorkshire County Council's Winter Health Strategic Partnership. This group will look for future opportunities where we can help people in fuel poverty, and will build on the excellent results of Warm and Well North Yorkshire.
You're that worried about trying to survive that you don't live, if you know what I mean. You just can't be bothered. Or I'd rather stop here in warmth than actually do anything. And it's, I'm glad it's changed. Because, as I say, it affects your mind. So with this project now that's run now, it makes, massive difference. There's no comparison really, you can't. It's a difference between living and surviving, you know what I mean?